day, everybody. Welcome to another episode of Health Podcast. Today, we're going for the discuss with about 117 and Adia with
Maurice Joseph Senesi.
Okay, Maurice, thank you for coming in. Maurice, the first talking point today, we're going to start with how 117 came about and like the history about 117, how we start, how far we're there right now. So maybe you give background about 117.
All right, okay. So 117 call center starts way back in 2012 when they start with a reproductive child health. Then Connaught Hospital, it all started. And later on from Connaught, we later on moved over to WHO, and the time we moved over to WHO at the time where Ebola came in now, within the 2013, 2014 and all. So we moved over to WHO. And from there, we later on move again to Airtel and then to AFCOM. So, just after the Ebola, we later on come over here to EOC, where presently, of course, are the National Public Health Agency. So, yeah, we've been here since then.
Okay, thank you very much. So, we want to know how far, like, 117 how do they operate, mainly like receiving calls about sick and how do they dispatch them and there are after things and if they give details about it.
All right, okay. And 117 call center, of course, it been a popular toll-free line, in fact, the most popular toll-free line. So whenever we receive all these calls, we get, of course, professionals. They answer these calls when we operate them. They answer these calls and of course log them into the system. And of course we get a particular system also or team where they for dispatch all these cases them when they come in. Immediately when the cases they come in, then they dispatch them to a different other team where they're outside. Let's say we also can send them to coordinators them. We also get coordinators to all of the people where they answer calls them. Where are DC coordinators them. We can send this information also. Let's say if it requires for make names to come in, we send them over to names. If it requires for make the burial team or the ambulance, the fire force services, they come in, of course, we also make them know. And the process in the 117 call center, of course, we're there to answer these calls, like every call so they come in, log in every information and details into the system, and of course dispatch them to the dispatchers then. And the dispatchers, of course, and then they send this information all around.
Thank you, Mr. Maurice. So then again, we'll take you to the next question because you mentioned about fire force.
Okay.
So I think a few months back, I don't remember, we get an incident at RC Bank along the branch, Juba Junction.
Okay.
Most them be born. So I've been speaking to them, they call 117 Cardinal Center, they call effectively. How I can manage the incident in there? Because I notice say now they can be demanded. How I can manage the incident in there with people that they call for like police case, understand, thief business. How I can manage the incident in there? I don't know.
Okay, so
small background.
yeah, so this is another reason again why people need to know exactly the value of 117 call center. Because like you calling 117 for prank, like for call for disturb, where a lot of people that they ever call 117 in the area of fire force. This is ever should see people that know the value of 117 being a toll-free line. Now, let's say person that call 117 in the area of fire force, where a fire force number is also called, that already don't send a message say, you know exactly say 117 number, a popular and of course like health emergency number. You understand? So now, in the area of fire force, whenever we can get issues related to fire incidents the way they happen, immediately, as soon as these calls come in, we they ask the person, of course, for a name and a location because we want to know the nearest fire force team where they around that particular person they will be able to dispatch this case here too. And of course, we can get a number instant, as soon as you call, we give them a say, there this number, so please, we said to do follow up with regarding that same process. We never engage you on the line. Like we get to ask you all the other questions, and no, we just need like your name and of course your location. That's the key thing that we need. So from then, whenever we get this information there, so these two, of course, we don't give you the number or the fire force team really close to you, then we set to do follow up on we on site. So we okay with people they call 117 with regarding something where we not get like full control or hand in. We okay with that because of what's in we serve as an emergency call center line, and of course it is our job and our responsibility that we regarding anything when health wise we are supposed to step in.
So I can call 117 at any time, like 247, they operate 247?
Exactly. 247, we get team with the work, we get the early shift, we get the late, and of course we get the night shift with the work. The night shift, the early shift starts from 7 in the morning to 2, and of course the late shift from 2 to around 9, and of course the night shift from 9 till the next day in the morning hours. Then early shift comes, so it's a 24-hour business.
So what about the people that they isolated village there? In case they call 117, how can they be reached out to them, give them the assist with the, for instance, the person who in a Falaba, what else in Mongo, in a limited area, to call say, hey, we get supposed to now we see how can we liaise with the ambulance team?
So on we on side, not to we, they go out there at the field for go pick up people that were sick or anybody or respond to fire emergencies. So we get different images that we work with, where of course we get the cross, we get the names, and etc. So yeah, so this team or these people they also like respond to most of these incidents that we call, and they go. It doesn't matter the location, the village, and district, they always respond out there.
Okay. So thank you very much, Mr. Maurice. They always say 117 work effectively and it will work 24/7. So now, Lord can do a quick test, yeah?
Okay.
Lord can do a quick test, Lord can tell for reach out to the 117. Alright?
Okay.
Let family and believe say 117 will operate. Look. Hello? Hello? Okay, so from Valentina, they 117 effective. So then they pick up, you can call them anytime.
At
So,
any time.
Mr. Maurice, is there anyone what you want left with Fambulen?
Yes. So this number for Fambulen. 117 call center, even though not free, everybody get access for call out. I want to let we able to know exactly the purpose of 117. And this purpose of 117 now for health emergencies, related public health emergencies then. So please, do ya warn you begin, talk to you begin, you never advise everybody around you, say make them not call 117 for the call and disturb. Because if you call for disturb, imagine say somebody there now a point of where it not gets nobody else for call, now only 117, a life there at stake. Then you the call on this 117 line here, so you don't hold on the line. Then like us the end of a loss in life, how you will feel. So please do ya warn you begin say make you not ever call 117, especially if na for make fun, joke or curse. Because I know we can't say back make you not call 117. Probably you might also be in a critical condition and you begin at the only person around. So let you know use 117 line for play and disturb. Yeah? So that is I can even say because this area of prank calls really they disturb me, Mr. Joseph. It really disturb me. So please, I would just want to make Fambulem out there for know exactly say 117 are a public health line where we deal with public health emergencies. And we really don't want to make anybody with a call and disturb this line as so because we get huge calls the way they come in.
Thank you very much. So Fambulen and the word that, yeah, in case you get any public health emergency, be it accident, any other thing, you can call 117 and then try for liaise with other people and for reach out to you for any emergency. Thank you very much.